Hi, my name is Erica Silvera and I'm a student at the University of North Florida. Today I will be showing you how to perform a nutrition-focused physical assessment. The first thing that you should do when you walk into a patient's room to perform this assessment is introduce yourself and ask for 2 patient identifiers. Hi there, my name is Erica Silvera and I'm a dietetic intern. Can you confirm your full name and birthday for me, please?
My name is Patty Silvera. My birthday is July 13, 1961.
At this point in the handshake, it's a good time to test their hand grip strength if you don't have the hand grip strength dynamometer with you. The next thing you should do is ask for the patient's permission to perform the physical assessment and explain to them the purpose of it. I've come today to perform a nutrition-focused physical assessment on you. The purpose of this assessment is to collect information physically regarding nutritional status and searching for any nutrient deficiencies, muscle wasting, or fat loss you might be experiencing. Is it okay if I perform this exam on you today?
Sure.
The best way to perform this exam is to walk the patient through exactly what you're doing when you're doing it. Before you begin the exam, it's important to wash your hands and put on gloves. The first area to begin with is the head region. Explain to the patient that you'll first be looking at their temporal region of the head. Stare at the patient head on and ask them to move their head side to side. Then explain to the patient that you'll be feeling their temporal region. At this point in a malnourished patient, you would be looking for any hollowing or scooping depressions. In a well-nourished patient, you would feel a defined muscle here. In a malnourished patient, you might also be able to see the temporal bone protruding right here in the head. While you're in the head region, the next area to look at is for any subcutaneous fat loss in the orbital region. You might also notice any black circles or hollowing depressions under the eyes as well. The next area that you'll be looking at is the clavicle region. In women, it's important to note that some of the clavicle bones are prominent naturally. In men, this isn't the case, and in extremely malnourished patients, you would see a very protruding clavicle bone. At this point, you can ask the patient for their arm and ask them to place their palm against yours and push against it. Push back against their palm and feel behind their scapular region. At this point, you would be able to feel any depressions between the scapula or the shoulder and spine. You can also at this point ask them to continue pushing towards your hand and feel for the ribs sticking out or any depressions in the lumbar region. The next thing you can do is ask the patient to stand with their arms by their side and observe the shape of their shoulder. In a well-nourished patient, the shoulder will be rounded, like so. In a malnourished patient, you would notice the acromion process sticking out and it would look more square. You can then ask the patient for their arm, and here you will feel for any subcutaneous fat loss in the arm. In a well-nourished patient, your thumb will be far away from your index finger when you're pinching in this region. In a malnourished patient, your thumb and index finger would almost be touching each other, signaling subcutaneous fat loss in this region. At this point, you can also ask the patient to make a circle with their thumb and their index finger. Here you'll be checking for dorsal hand muscle loss. This would be a depressed area between the thumb and the forefinger. In well-nourished patients, you would feel the muscle here. Next, you will be checking the lower region of the patient's body. At this point, it's best to ask them to take a seat. They can sit in a chair or on the side of their bed. It's also best to have a low piece of furniture on the ground, or you can just get on your knee like so and ask them to place one of their legs on your knee. The first area you'll look at here is the patellar region. Notice that in a well-nourished patient, there would be muscle present around the patellar region, and the patella wouldn't be very bony. However, it is important to note that some patients have naturally bony prominences in their patellar region, So it's good to ask them if that is a normal presence. The next area you'll be looking at is you can take a look at their quadriceps region. In the malnourished patients, you might notice a thin line or depression on the side of their quadriceps, or any muscle loss or muscle that's not present typically in the quadriceps region. The next area that you'll be looking at in the leg is the calf region. In well-nourished patients, you'll feel a well-developed bulb of muscle. In malnourished patients, you would feel minimal to thin muscle. Another important thing to note in this region is the presence of edema. Patients might have very deep to pitting edema, and it would be noticeable with all the fluid accumulation in their legs. It's also important to note that this could be present in their arms as well. To test the depression, simply push your fingers into the edema, and very deep pitting edema will take about 31 to 60 seconds to return to normal. I hope I've been able to assist you in how to properly perform a nutrition-focused physical assessment. Thank you.